be obsessed. First 5 years, I'll just eat, sleep dentistry. I think that's probably the fastest way we can get to where we want to be.
Hey guys, welcome to the CPD Junkie podcast, where we bring you interviews with dentists sharing their CPD stories and journeys from around Australia. Greetings CPD Junkie, I'm your host Laurence Doan, and today we're joined by Dr Bryan Liew. He graduated from his BDS with honours from the UQ in 2020, and he currently works in regional New South Wales, Tamworth. He is a proud member of the ADA, and today he is particularly interested in endodontics, porcelain aesthetic restorations, and biomimetic dentistry, which focuses on restoring teeth in a natural-like strength and function. Dr. Liew also active in professional courses to increase his expertise to better serve his patients' needs. Dr. Bryan Liew, welcome to the show.
Hello.
So before we get started, Dr. Bryan, tell us about how Tamworth is treating you.
Well, as a regional town, I think it's not too bad. I think I got used to it being someone who grew up in a city. It was a lot more, it's not as quiet as I thought it would be, I would say. Yeah, it's still quite accessible to go to cities and everything with the flight and stuff like that. So it's not too bad.
Yeah, that's good because, I mean, for a lot of recent graduates, they often contemplate whether it's worthwhile moving to regional cities or metropolitan cities. So what was your take on that? And, you know, if someone was making a decision, what would you want them to ask them to consider?
I think, well, at least personally, I am a massive fan of, like, at least for a fresh graduate, to work in a regional environment, just because, like, as a fresh graduate, you know, there's so many uncertainties in, you know, our capabilities in our career and things like that. And as far as I'm concerned, as far as I've been told, like working in metropolitan areas, working in a city, like the patient base that you have a certain expectation as well, which adds to a lot of stress to like a fresh graduate, you know, like for example, having all sorts of procedures that, you know, we can do it, but we're not so sure if we are good enough, things like that, you know, the imposter syndrome coming in on top of that, you know, with patients who are not as forgiving as regional residents, I would say. I'm 100% all for regional, at least for the first like 3 to 5 years, I would say. But it's just that not everyone is willing to move out here, you know, and live a quiet life for a few years, I would say.
Yeah, that's fair enough. So let's dive into it. So how did your CPD or dental journey kind of begin from when you graduated?
So when I graduated in 2020, so I started working in 2021. So it was about 2 years ago. And it was still the COVID era, you know, most things there were a lot of online webinars, you know, a lot of things were done live on Zoom instead of in person. So it was good and bad at the same time, in a way where a lot of things, obviously, you know, especially in dental related stuff, you kind of need a hands-on component. But at the same time, because a lot of things was on Zoom, you could access a lot more CPDs online that are not in Australia. Like for me personally, even in year 5, before I even graduated, I joined a lot of online webinars and everything that was done in US. So I woke up at 3 a.m. in the morning to watch some of these webinars, just because, you know, back then, you know, the craze of biomimetic dentistry and everything, it just came out on Instagram. And, you know, in Australia, we didn't have that many courses with that yet. But a lot of the more renowned dentists in US were actively giving out free webinars. So as a student, you know, we don't have to spend money. It was free. All I need to do is wake up at 3 a.m. You know, it wasn't such a bad thing. And that sort of carried over to 2021, you know, when I started working. And obviously being in a regional town, it's not as easy to say, hey, I'm going to go for a weekend course this weekend, things like that, because everywhere we go, Sydney, Melbourne, Brisbane, I have to take a flight, you know, I can't just take 1 day off. I got to take 1.5 days off, you know, things like that. I got to book everything. So it was a little bit inconvenient, but but half of it was, it was okay still doing a lot of them like, online and everything. You don't learn as much, I would say. Like there are certain things like, for example, CEREC courses and everything, you have to do it in person.
Mm-hmm.
Yeah, but I think for the majority of it, I sort of managed to um, learn. I think theoretically, I could learn a lot um, online, I would say. And I think a lot of courses nowadays as well, they also have the online component to it because they realize how, in a way, useful it is
Yeah, well, I mean,
for people
let's
to
dial
access.
back.
Yeah,
Let's dial back a little
yeah,
bit. So, you're graduating, right? And for
yeah,
a lot, you're keen to kind of get in and start doing a lot of this work, and then
yeah,
COVID hits, and you're just like, oh my gosh, like I'm rusty, and I'm gonna feel even more rusty. I mean, can
yeah.
you speak to some of the people, they're probably in the same boat, like what it was like feeling at the time? Did you feel more anxious and just want to like do more dentistry?
I would say yes, for me at least. I think
Yeah.
I was a little bit obsessed about like biomimetic, like, something like a particular field. I think all of us have that particular interest in something, be it endo or like crowns or whatever. And like for me, I was like particularly obsessed about like, how do I bond better, all the craze. And that sort of made like the lockdowns and everything sort of made me want to work, want to go and my hands were itchy and I want to do something, but at the same time, we couldn't see many patients. There was like restrictions everywhere. It was sort of like a pain. So I think it wasn't easy, but like a lot of things we could still in a way practice at home. I would say I had like all those 3D printed models. I was practicing different stuff,
The two
like make my
Legos.
yeah, the tooth Legos. Yes, yes, I had tooth Legos at home. I was like looking up stuff. Checking out like what I could do at home, or like for my patients and things like that. I don't know. It's just find something to do while being stuck at home. That's what I did.
Yeah.
Um, but yeah,
How did you kind of come about finding these online courses over in America that needed you to wake up at 3 o'clock in the morning? Like, where were you looking, and why was biomimetic dentistry like the place you wanted to go?
I'm not sure how I stumbled upon biomimetic dentistry. I to be honest, I gotta give props to Instagram because like like everyone's an Instagram dentist nowadays. But like with regards to the courses and everything, there were Facebook was a good way to sort of find a lot of these courses because of how the algorithm works and everything. You search for one like biomimetic course and then like this the ads just keep coming.
To keep you
And
hooked?
yeah, I was down in a rabbit hole, and it sort of made it easier in a way because obviously because of the algorithm, it made it easier for me to like look for the next course, and everything. And also, I think I sort of follow quite a few like dentists who I would try to emulate, and they also post on their stories and things like that on like a certain webinar they're going to talk on and things like that. So it sort of just provided different avenues for me to find what is as a student, what is the most economical way of learning, because we know that courses are not, if you want to do every single course, we probably cannot afford it as a fresh graduate. So there are many ways to sort of like hack the system to learn as much as we can, at least in the first few years. Yeah.
Yeah. Well, one of the graduates probably find difficult as well is, when you're learning about biomimetic dentistry, it requires particular tools, particular equipment. Like, how do you kind of go about learning these things and then applying it if, maybe the practice doesn't have these things?
For me, okay, I'll use myself as an example. Like, in biomimetic dentistry, for example, they talk about using your SE bonds and everything, two bottle system. But we know that a lot of practices use universal bond, a single bottle system, just to make stock taking a lot easier and things like that. And that's how my practice works as well. I don't have two bottle systems. I use a single bond and everything. But
Oh, controversial.
yeah, very controversial. Yeah, but like for me, there are some things that I buy myself, my aqua care, things like that. It's gonna be me using it. I was willing to spend the money and just to up my own game in a way. but at the same time, I try to make full use of what I have. I think it's a spectrum. It's not like, it's either, I follow it to the T or I don't do it at all kind of thing. It's more like it's always a spectrum. At least that's how I understand it. Like if we have a limited resource and like limited tools, for a fresh graduate working in like, accidental clinic, and, maybe their practice owner didn't want to spend on a lot of things, they were like, just use what we have, things like, and I think it's quite common. I have a lot of friends who told me the same thing as well. And I think all I can say is just make the most out of what you have, and just improve as we go. Because it's great if we can follow literature to the T, but unfortunately, in day-to-day clinic, we don't really have that luxury in a lot of situations, I would say. Yeah.
Yeah, kudos to you for getting the aquacare. I mean, lucky you work at one clinic. I mean, if you were working at
Yes.
multiple clinics, just imagine carrying your Pelican
Yeah.
suitcase around.
Yeah.
Yeah, let's dive into endodontics, because I heard that you wrote an article on different irrigating solutions on MTA or something. You went even to present on a research day on that?
Yeah, that was my year 5 honors program honors project that I did with some of my mates. Yeah.
Yeah, so tell me, what did you do about endodontics? Like after you came out, you have, like, how do you go about learning endodontics in a COVID, era?
Um, that was a tough one. I think for me, I've only attended, I would say I've attended only one endo CPD after graduation. That's with, finding MB2s and all the stuff and learning different files as well. Uh, but that was a hands-on course because obviously in endo, there's only so much you can learn online, and most things will be done, in person. I was lucky because like, um, at least 2021, COVID sort of died down and things were catching back up again, things like that.
Sure.
Um, but yeah, that sort of like, how would I put it? I think I was a little lucky, I would say, in uni where I did a lot of endo, because that was my interest anyway. And in university, everyone gets a different amount of patience. It's not like it's not super fair, I would say. Some people get more endo patients, some people get more crown patients, things like that. And for me, it was endo, so I managed to do a fair bit, and I managed to try a lot of different files as well. After I graduated in my workplace, because my practice owner was very open to letting me try whatever new files that I want to get. So he was like, "Oh, you want to try this file? Yep, let's get a set of it. Let's try it." Because he knows that I was very interested in endo. So he was quite, I would say he played a big part in allowing me to explore a lot of different like systems to find what works best and what works predictably in my hands, I would say. So that's probably me. And obviously right now, the entire clinic, I think I do most of the endos.
So you're the
Yeah.
endo guy.
Yeah, in my practice, I am I am the person who does most. I think because not a lot of people like endo. I realize in private practice, a lot of people are like, "Oh, I don't really like endo. You want to do it, go and do it," kind of thing. So I used it to, it worked in my favor, I would say, because like I was more than happy to do all the endos, no matter how difficult it is. Obviously, within my scope, and most of them will refer to me. And if I say I can't do it, then only we refer to the specialist, because in Tamworth there is no endodontist. So our closest specialist referral is Newcastle.
Wow.
So by hook or by, yeah. So it's like a 3.5 hour drive away, and they're always fully booked, like 6-8 months in advance. So most patients are more than happy to be like, what, let's just try, let's just do it, and things like that. So it gives me, I would say, a lot of opportunity to improve and to just up my game, I would say. And with regards to files or different irrigants, different all the tools, endo has like 1,000,001 tools, 1,000,001 brands as well. Yeah, my boss is, I would say my practice owner was quite I would say quite gracious in just letting me like, okay, Brian, what do we need? What do you think we need, for all of this? All right, let's just get it set, see how we go. And, if we like it, we can get more of it, things like that. So he sort of just gave me the green light to do whatever. And I think I would say I'm blessed because, I acknowledge that not everyone would have a practice owner who just let them order whatever they want in a way. Um, but yeah, I would say, yeah, I was lucky. I was a little lucky.
No, that's fair enough.
Yeah.
So let's dive into
Yeah.
something as a CEREC enthusiast. How did you become a CEREC enthusiast?
Oh, I think this all started with like, in year five, where, all the biomimetic stuff and everything. Then I was like, oh, CEREC and everything. And I think I would consider myself a very tech-oriented guy. I build my own computers, I have a 3D printer at home right next to me, things like that. I was like very, very into digital stuff. And even when I was applying for a job after graduation, like I shortlisted the only places I applied to were the places that had CEREC. Like I knew that was the path I wanted to go down to. I wanted to, incorporate digital dentistry into my everyday like life in a way. So, getting into that, obviously the first few months barely touched it, as a fresh graduate, you know nothing about it. We didn't, I think even for me graduating in 2020, we never touch a scanner. I think now a lot of universities have scanners to let the students learn. We didn't have that opportunity. We usually took PVS impressions and things like that. So everything was new. And so, the first 3 to 6 months, barely touched it. All I scanned was my own mouth, my DA's mouth, the models and things like that. But my boss was happy enough to just let me play around with it, learn. And only after I did a few CEREC, like a CEREC course by Dr. Laurence, and that sort of propelled my entire like journey, I would say, into CEREC, into, being confident and efficient in doing it day to day, as compared to before a course, where I was like always guessing myself, oh, am I doing this right? Spending 1,000,001 years to design a crown and things like that. So yeah, I think those courses really made me, do a lot better
Mm-hmm.
and be a lot better in what I'm doing at the moment.
Yeah, that's fair enough.
Yeah.
For a lot of our listeners, he's not referring to me. He's referring to Dr. Laurence Doan, just in case people think I was referring to me. So, I mean, okay, you just mentioned that you have a digital printer. So, talk to me about that and that side of things.
Oh, yeah, I bought a Sonic Mini 4K, like, typical entry level 3D printer. I got it from my own house, to be honest, just to print models and learn and play around with it. I think it's definitely the up and I think if you saw on DPR this past 2 weeks, every day there's a post about 3D printing. I think it's definitely the next big thing. And I think it's gonna play a very, very big part in, well, at least in America, it's playing a very, very big part. Not in Australia just yet, probably. We are just printing models here and splints and things like that. But I think in the coming few years, definitely going to play a big part in our day-to-day dentistry, I would say, because it's a lot cheaper to get into as well, as compared to buying a milling machine and things like that. So yeah, I have a Sony Mini 4K. I bought all my curing stuff, and yeah, just learning how to print models and temporaries. I guess that's at least what I'm
Nice.
trying to do at the moment. Yeah.
So how are you learning it though? Are you learning it through talking to your lab? Are you learning it through just downloading ExoCAD or Mixmasher and just learning through the modules online? Like,
I'm learning it through there is a few online webinars that I attended previously. Um, it's a little bit difficult to learn it online, I would say, just because, it really depends on the printer, what program I have access to, whether I'm willing to pay for a subscription, for example, like ExoCAD, it's like thousands of dollars, which I'm not willing to as a home user. So, I'm using a lot of free programs. I'm using like, MeditLink, which is free. I'm using Chitubox, which is free, like maximizing what I have that are free to learn the ropes first in a way. And I managed to come across, quite a lot of like quote unquote free content on YouTube, and YouTube is amazing. Like, we can learn so much on YouTube, and a lot of dentists also post their tutorials on Instagram as well. Yeah, which that's I just leverage on all of this to learn as I go and just troubleshoot, make mistakes, ask on Facebook, things like that. Yeah. I would say the learning, there is a certain learning curve to it because, there's a lot of mode of failures for 3D printing. Like one wrong number and everything just falls apart kind of thing. At least for the printer that I'm using, because it's an entry level printer, it's not like a $10,000 printer which is a plug and play. So you get what you pay for, I guess. Yeah.
And that's fair enough because a lot of,
Mm.
recent graduates are like, yeah, I'm learning about intraoral scanners now and I see printing is like the new frontier and I want to dive
Mm-hmm.
into it. But kudos to
Yep.
you again for purchasing all this stuff and going learning it. A lot of them are like,
Yeah.
I'm just spent a full day at work. How do I have the energy to go and study and go and learn some more?
I mean, I was gonna say I totally agree with that because like I have a lot of friends who say I'm crazy. Like my boss says I'm crazy too. Like 24/7 dentistry, I would say.
So next comes communication. Talk to us about how communication is very particular for a lot of graduates, right?
Mm.
Learning all these difficult dentistry cases and all of that, how to communicate. How did you kind of go about that?
For me, well, a little bit about my practice. Like when I first joined the practice, my practice was under like prime practice. So, we had access to prime speak and things like, those typical communication calls. So my manager said, Brian, go for it. I think I did it. I did the entire prime speak thing in like the first month, with the course and everything. I wouldn't say it's
Wow.
like, yeah, I mean, even all the Zoom calls and everything, like I wouldn't say, I would say it was a good base. I don't really fully follow it anymore because, of many other reasons. But I would say for me, at least, that sort of gave me a baseline on where to start and sort of find my own style of communicating. But I definitely have to acknowledge the fact that coming from university, working in a public system, because all we see was hospital patients and everything was free, and then transitioning into a private practice where cost is a really big thing. That was a really big challenge. And I'm gonna assume that it's gonna be a big challenge for, I would say, most, if not all, fresh graduates, talking about costs, talking like treatment planning, and things like that, because um, we were not trained, unfortunately, in university to factor in these kind of things. We were only trained to talk about what's the best possible dentistry here, all the disease control phase and all the definitive phase and the typical viva questions and everything. Unfortunately, that at least for me in my experience, that didn't really go very well in a private setting because at least in Tamworth, patients are I would say they are not as highly educated in their family background as compared to, let's say, a family in the city. So they are all like, what's the best thing to do? Let's do it right now. It's a very different like human interaction, I would say. So for me, I sort of learned it the hard way where, a lot of patients saying no at the start until I realized, okay, what am I doing wrong here? I'm not saying something wrong, am I treatment planning wrongly? How do I make my patients understand the value and things like that? And I sort of just dialed it back and just started to educate myself and educate the patients as well. So instead of like telling them ABC, what they need and things like that, I sort of just spend some time talking to them, understanding understanding them a little bit better, building rapport. And I think I planted a lot of seeds. It's more like for me, I found that worked for me in terms of communication, where I just educated my patients and let them decide. I think that took off a lot of stress and sort of made sense for me at least.
Fair
Yeah.
enough. So, I mean, there's a lot of courses that you've done. Have there been any particular ones that you felt that you didn't quite implement or wasn't as beneficial for you at the time and you would do differently next time?
Yes, there's a few. I would say a couple, not a few. I did some pediatric dentistry ones, which, um, to be honest, added no value to my at the time because I barely saw any pediatric patients, things like that. And also I think I did like an implant kind of like webinar seminar with a small hands-on component, but I don't do implants at the moment, so I don't remember a single thing that I've learned in that in that weekend.
Yeah.
Just because obviously a lot of these skills you basically give it away if you don't practice it, probably within the month, I would say.
Yeah.
Um, yeah, so looking back, I probably would not do it until when I'm ready to pick that up and look for patients or have the patience um, to perform these procedures, I would say.
Yeah.
Yeah,
Fair
yeah.
enough. So I'm gonna pivot a little bit. There are mentors during our career path. Who's been a big mentor to you and why?
For me, I would say my boss, my practice owner. Um, I think when I first started, um, it was more like I didn't get much, obviously, chair side mentoring or like coming in and help me, besides a few different extractions. But from a treatment planning, from a problem solving perspective, which was something I think, at least for me as a fresh graduate back then, my knowledge was limited, in terms of like overseeing bigger cases, like a rehabilitation or let's say a patient who comes in with a lot of problems. I think for me, I was quite lucky where my boss was always there to like after work, I can just bring it to him. Hey, what's going on here? Can we have a sit down for like 5 minutes? Can we talk about what you would do in this situation? And then we sort of throw ideas around. Um, and he would sort of challenge me, intellectually. Okay, what do you think this problem here is, and things like that. So I think for me, he played a really big part in my first, at least I would say my first 2 years out, um, because that was where I was trying to um, sort of changed my perspective on like I think as a fresh graduate we look at a lot of like single tooth dentistry. We always want
Yeah.
to yeah, and then but then moving if we want to sort of up our game, we got to look at the whole mouth. What are all the problems going on there? How do we you know solve it? Number one, how do we communicate with the patient that there is a lot of problems going on, things like that. So yeah, he played a really big role in allowing me to grow in that aspect. And at least now, um, because my boss does most of the orthodontics and implants as well in my practice. I'm only learning ortho at the moment, but he brings his cases to me now as well, where he will just sort of get me to treatment plan it, and then we discuss cases. So there's a lot of, for me and him, like he gives me a lot of opportunity to learn and just like be in a habit of treatment planning and problem solving and things like that, which is sort of, I'm very thankful, I would say, that he's providing that environment for me to grow. Yeah. So yeah.
Yeah. No, that's fair enough. Because like a lot of graduates, they come out, they're looking for mentoring. So, what are
Mm.
your thoughts on recent graduates looking for mentoring?
I think mentoring is important. It's good that number one, we are looking for mentors, but unfortunately, we may not always be blessed with a good mentor at our workplace. Um, but that doesn't mean that we can't find mentors. We can always find mentors elsewhere outside of work, in study clubs, or in different acquaintances that we can make, in different courses. I'm pretty sure a lot of more experienced dentists out there are more than happy to answer a question, that you can just send them a PM. And I think, at least for me, some of my peers, they were expecting chair side mentoring. And unfortunately, that's not always going to happen. And I would say that it's a little bit difficult to expect that from, let's say for your boss or someone as well, because they also have their patients. So I think the expectation has to be adjusted a little bit, and just like understand that, you know, being a mentor doesn't mean that they're going to be there to, you know, uh, hold your hand, but more like being there to help you solve a problem intellectually, or like, from a higher level perspective, and then sort of point you to the direction that you need to go, kind of thing. And then like let you tumble and turn and make your mistakes and learn along the way kind of thing. At least that's how I do it. Like with that expectation, we are more likely to be satisfied with the outcome instead of like, oh, I want the mentor to be always there and things like that, and then become disappointed, and then I think that's setting ourselves up for failure, I would say.
Yeah. I think it's important with any relationship to always have an open communication with your mentor about what you kind of need or want, and see if they can reciprocate, or where they expect you to be in terms of what's on offer. I think that's important when it comes to discussing about mentoring, because everyone speaks to it about it differently.
Yeah.
So I mean,
can I add to that point?
Yeah, go for it.
Yeah, because I think I can't remember who told me this as well, because like everyone's idea of mentoring is different. Some want chairside mentoring, or like someone's like, come in and save me from this difficult situation, and some don't want that at all. Some just wants you to be someone who they can bring a particular problem to and just talk about it and discuss and then let them do it. So I think, like what you said about open communication, I think that's a good point right there, because everyone's idea of mentoring is very different, or everyone prefers to be mentored in a different way, I would say.
Have you been listening to on my podcast too much times?
Maybe.
So the next thing I want to ask is, have there been any struggles in your dental journey so far that some of our viewers might not know about?
I would say yes, in a way, in my dental journey. I think I suffer from a little bit of, I suffer from imposter syndrome, I would say, where sometimes I always feel like, am I good enough to do this for my patients, or do I just send it to my boss or whoever, things like that. Or so I find myself delaying, let's say, a patient comes in, complicated case or whatever, and I'm sort of like delaying the consult, or like, okay, we'll just stick some scans here, let's get you back in. I'm sort of like always having the next consult appointment. Maybe subconsciously I'm thinking I'm not good enough to solve this problem just yet, or I'm not sure about this, I'm not sure about that kind of thing. So I think for me, I do suffer from that a little bit. And I think because also, like, we see time and time again amazing cases on Instagram, and then like, oh, am I doing this right? Am I doing this wrong? How do I achieve this? What if my patient's not happy? There's so many sort of like doubts. So that's definitely something that I struggle with. And I think it's a daily thing where, I gotta get over it. I think all of us have to. But yeah, that's definitely one of the biggest obstacle, I would say, for me. Yeah.
Yeah. How about bonding two CERECs side by side at the same time?
Oh, learned that the hard way. Yes, the first few times I did like side by side ones. Oh my goodness, like definitely learning the hard way. Both CERECs, didn't see properly. Cement all over the place. Cured before I seated it. Fully seated it. I had to cut the crowns off. Oh my goodness.
Oh my goodness.
It's definitely it. That's like the first. I would say that's probably like the first side by side one that I did that went through that, and I realized, oh, your mistakes are your best teachers, and now it never happened.
So what do you do
I was
now?
scarred. Yeah. Now I cement it like separately, Teflon, everything. I make sure things are right before I go in and be a Superman, basically.
No, that's fair enough.
Yeah.
So what does your current clinical day or ideal clinical day look like? The type of things that you want to get up to.
For me, right now, my ideal day is, the mornings are usually the bigger appointments, the harder ones, my root canals, my CERECs, or my rehabs or whatever. My afternoons are, a couple of recalls here and there, some emergency appointments, and new patient exams. I normally split my day up like that. So, the caffeine is still running in my blood for me to do my morning, my big stuff. And then afternoon, I can just slow it down and talk a bit more and do a bit less kind of thing.
The food coma.
Yes, 100%. Yeah.
So what do you hope in 5 years' time, your clinical day could look like, and what kind of courses are you doing? Because you mentioned ortho there a little bit, so.
Yeah. So hopefully, well, 5 years time. Well, 5 years is a long way to go. But definitely more ortho. Hopefully throw in some implants here and there. I hope to see myself doing, some hollow nexus and some full arch stuff. Hopefully. Um, don't know whether that will be 5 years or maybe more than that, depending on, whether I suddenly find interest in implants or not.
You got to get on it quick then. You got to get on it
Yeah,
quick. I mean,
definitely.
ortho is going to
Yeah.
take you another 2-3 years.
Yeah. So I think for me, I don't have that much being in Tamworth and doing ortho as well and everything. Like it's already half the year gone. Like I can't really be flying to the city every month to do a course kind of thing. So I think that's the biggest downside, at least being where I am right now, where like, for example, I'm doing my auto course now where every 2 months I'm in either Sydney or Melbourne or Brisbane and things like that. And it's like 6-7 times a year, 2 years. And then on top of that, I have my other courses as well. So it's very hard to find time to constantly do courses where I have to factor in the travel time, the travel costs, I got to close my books, and things like that. So that's, I realize now that I'm going through this, I realize how difficult it is to juggle your time. When you want to, yes, I have so many things. I think that's the biggest challenge right now. Like I have so many things I want to learn. I realize I don't have enough time to go and learn it all. Yeah.
No, that's fair enough.
Yeah.
I mean, yeah, you'll come to realize that's the case as you kind of get older, and then
Yeah.
you have more responsibilities and
Yeah.
other people you have to think about. I mean, so how about your non-clinical day? What do you want to kind of get up to, or
My non-clinical day. Well, if you're referring to after work and non-dental stuff, hopefully I'm going to pick up golf this year. Since my family and my friends constantly bug me to pick up golf so that they come and play with me. So definitely picking up golf this year and hopefully start gymming.
yeah.
Now that I'm 30 this year, my goodness, I feel like my body is failing me. And if I don't look after it, I'm gonna be in trouble in 5 years' time. So that's definitely on my list, on my to-do
You're getting
list.
some of that back pain, are you?
Yeah,
neck
slowly
pain.
getting there. Yeah, even my Pentax loops can't save me now. I gotta work out. Yeah, yeah,
You need the microscope now.
yeah. I need a microscope now. Yeah.
I heard you like experimenting with specialty coffee. Is it coffee in
Coffee?
Malay?
Yeah. I do a fair bit. I mean, I love coffee a lot. Yeah, I just recently built an entire coffee setup, like the bench and everything, because I make my own coffee at home. So that's one of my hobbies, I would say, just buying coffee beans everywhere and making it at home, I'd say.
So what's the secret to a good Malay coffee? Is it butter, sugar? Like what's that?
Oh, like Malaysian coffee? To be honest, condensed milk. If you're talking about like true like Malaysian coffee, condensed milk. Yes, 100%.
Well, I mean, you're originally from Malaysia, right? The nation
Yes,
of
that is.
nasi lemak. So what
Yes.
Malay food do you miss the most? And what Malay food do you think is like mostly underrated?
The food I miss the most, definitely nasi lemak. Like nothing here compares to what you can get back home. But the one dish that is underrated. Oh, that's a really, really tough question. That's the one dish that's underrated. A proper laksa. I think it's underrated. A proper good laksa. Yeah. Definitely.
So,
I think we don't have much options here. That's unfortunately the case.
so if you could share some words of wisdom to the budding young dentist or the fellow Malay dental student, what would you say to them?
Be obsessed. First 5 years out, just eat, sleep dentistry. I think that's probably the fastest way we can get to where we want to be. And while we are young, be a bit of a slave to your work. It's a bit unhealthy to say that. I'm sorry. All of us think about work-life balance and everything, but I want to quote Gary Vee. Just gotta hustle it out for the first few years. Because I think the first few years out where, once we're graduated, I think it's where we haven't lost our passion yet, where we are still, interested in it, before, we settle down, have a family, have kids, and then we have more worries in life than just dentistry. I think make full use of the time and youth to be a sponge and learn as much as we can, as fast as we can, and not be afraid of like making mistakes, I would say. Yeah.
Yeah. I mean, shout out to you. Like I said, you bought the AquaCare, you've got the 3D foam, the 3D milling printer at home. You're doing it all. So, Dr. Bryan Liew, thank you for coming on the show today. If you could let the people know how they can find you or what's kind of going on in your life.
Oh, just find me on Instagram, to be honest. Just text me on Instagram.
So, for our viewers, if you like this episode, drop a comment below on your favorite part, but don't forget to like and subscribe, and we'll see you on the next episode of CPD Junkie Podcast. Thank you.